Hi, everybody. I'm Dr. Qazi. I'm over in Newport Beach, California, and I'm a skin restoration specialist. I mostly do acne, I do scars, I do a lot with collagen. I really try to restore the face whenever there's aging process or scarring or some sort of sun damage potentially. I do a lot with lasers, but I also do a lot with collagen fillers and do facial balancing. So I want to talk a little bit about how we make sure our treatments are safe tonight. So that's kind of going to be the big subject that we'll talk about. I'll wait for a few more people to join us right now, but it's something that I care a lot about because really it's something I've seen in the industry where people have been a little bit reckless with people's lives even, and haven't really been as careful as I think they should be, and sort of like cavalier with a lot of the treatments that they offer or do, and they don't necessarily know how to manage the complications there. Martin's saying, let's go Dodgers. Awesome. Thank you. Yeah, we should take a look and see how's that going over there with the Dodgers game. Let's go Dodgers here. But yeah, the treatments that I do, actually I'm going to change the text a little bit. I try to make sure that there's a way we could do it with not just myself, but also the providers that I have on my team. And I'll kind of go through a little bit about what we do that essentially makes sure that, the Dodgers won 10 minutes ago. What we essentially want to make sure that whenever we're doing these things, there's pre-op before we do it. There's ways that we make sure that the skin is safe. There's things that we're going to do to make sure that you're safe during the procedure, and there's things that we're going to do after the procedure. So let's kind of go through a little bit of that process and kind of what makes us a little bit different. So it kind of was something I wanted to talk a little bit about because one of our patients, we discovered when we were doing a laser that his blood pressure was exceptionally high, and kind of interesting because how many places really check blood pressure before they do lasers? Kind of interesting, right? Like who actually checks blood pressure before they do lasers? Something that it's not really taught. Not anybody ever showcases that that's something you should be doing. But it ended up actually potentially saving this patient's life. He normally has normal blood pressure. He's a gentleman in his 60s, otherwise really, really good health. And his blood pressure was incredibly high. If we didn't check it, we could have actually caused a really severe adverse event if we had injected something like lidocaine with epinephrine, for example, for him. So, at one point his blood pressure was actually 220s, which was really high, and he was complaining of some blurriness and dizziness, and we didn't actually start the treatment yet. But we did actually do a little bit of topical numbing. And sometimes actually there's a component really where it could cause a little bit of anxiety, things like that. And potentially, he didn't realize it, but when he gets a little bit anxious, he could have actually potentially now have gotten his blood pressure really, really high. He also was somebody who did a lot of supplements as well, vitamins. And so all those things really could factor into it. But really the point of this is that these kind of things would have been missed if we didn't do something really safe, like take a look at his blood pressure, take a look to see is there a possibility, for example, for lidocaine toxicity as well. Even though it's topical, it was something I was concerned about. And I was shocked really when I was at a conference several years ago, and I was talking to a bunch of doctors and whatnot on the table, and people just weren't even aware about potential lidocaine toxicity. They're doing all this numbing around the mouth, and they weren't aware of the fact that there could be a concern with this, that you could actually end up getting methylhemoglobinemia, which could essentially cause a patient to have poor oxygen and poor oxygenation, and they weren't even aware of potentially even looking at the signs of it and how to reverse it. And that's really, really concerning. You're doing a procedure, even if it seems like it's benign, like topical numbing, everybody does it for lips and things like that. And it turns out it could be really, really risky for some patients if they swallow some of that. And now the practitioner doesn't know how to reverse the agent, doesn't know how to solve that problem, doesn't know how to save you really. I mean, I know that I say all the time that everything that we could do, we could help out if there's any problems with things. But it's concerning to me that people aren't aware of, like there's a maximum dose of lidocaine that you're injecting into somebody. People aren't aware of that. They don't like calculate that stuff. And I'm not saying like just people, I'm talking about like physicians and PAs and nurses that I've talked to. It's sort of like brushed aside that you have to do these things. And, it's something I've talked a lot about before, because, I do things that are more invasive sometimes, and we do blood work. We make sure we take a look at EKG as well. And it turns out that there's some people that don't do those things, and it's like, some people do, the phenol peel, they're doing it with a Valium in the office, and they think that's going to be like adequate for a patient. And even if they're doing, a heart monitor, the truth is that if you're doing the peel and it's a very intensive peel, what are you going to do if there's a cardiac arrhythmia? What are you going to do about this now? You're going to actually just leave that peel on the face and burn the face while you're trying to take care of the heart. It's kind of ridiculous the way some people are just so cavalier with this stuff, and they're physicians. And honestly, it's like it's sad to me the situation sometimes. I've talked about yesterday about like just inappropriate antibiotic use, things like that. But this is like really potentially a serious complication that could have occurred if we didn't take a look at blood pressure. Canola Skin Therapy is saying, how do you reverse lidocaine toxicity? Usually do benzodiazepines. So usually do that, but it's, ideally you should be calling 911. You should be taking a look and see the heart rate, because there's a chance that they could go bradycardic and get hypotensive with lidocaine toxicity. So there's a potential chance of that. So essentially, you really want to make sure that there's no heart block then afterwards, and then there's no option that essentially, you could make sure that if you have an EKG there, that you don't have to do any other kind of intervention, potentially like, doing a little bit of epinephrine if you need to, if the heart rate's low, or like I said, doing benzodiazepine. So flumazenil is like something you could potentially have in your office. We have also an AED, so it's a defibrillator. I talked to you guys a little bit about this before. Actually, I brought this up today because I had this patient, and he came in, and this happened this week. And then I followed up with him again today just to see how he's doing. And then today actually would have been my sister's birthday. She would have been 40 years old right now. And, she had died from sudden cardiac death. And I talked about that before, that it was like really unfortunate, because, there's multiple different reasons why it was unfortunate, of course, but it was a rhythm that really was shockable, and if she had gotten CPR on time, she would have been alive, really. And I know that there's a lot of different factors with the whole thing, but really it's like, it's unfortunate because she was found down, and then, they didn't do CPR in time. And it was like a delay to do CPR. And these things are just like, it's so sad to me that this kind of stuff happens. And that's like, of course, not in a medical office. I was actually at a restaurant when that happened. But I've seen stories. There was a plastic surgeon in like Colorado who, like a patient coded on the table while he was doing a breast aug, and didn't do CPR for the patient. And I think didn't even call the ambulance for the patient, things like that. So it's really like, it's sad and it's tragic that kind of stuff happens. I think that gentleman's ultimately, going to go to jail or something like that. But we have to kind of pay attention also, like this kind of stuff with the safety aspect of things. That I know that these things are, cosmetic procedures, but there is risk involved with them. And so that's why I take it super seriously. I take this stuff really seriously. To do whatever we're doing, we want to make sure that we could do it. Of course, we want to try to get results out of those things, but like safety, like is so critically important. And I don't know anybody, I really don't know anybody who does blood pressure checks before lasers. And I do it all the time for our acne scar patients. I don't know if anybody here has been doing our acne scar patients, but I check your blood pressure, and they always show it to me. They always go through it to make sure it's really safe for the patients before we do these things, because we are going to do things like medications that could potentially cause problems with arrhythmias. Very, very low risk, but like today we caught someone. It could have happened. Really, it's like, The thing with me is that I worked in so many intensive care things. I did so many different things all the time. And I saw like that 1 in a million chance, I saw it so often. Like it's like the freak accident. How many times have you been on a ladder? And then I saw somebody that with like, people with like that their necks got snapped because they're on a ladder and things like that. And it's like, it wakes you up, you see that type of thing that ends up happening for some people. And it's really eye opening. Like, first of all, you're grateful for the fact that you could have your health, but at the same time, you want to keep it and you want to do things to make sure that your patients are safe. So it's like a lot of little details like that. Sometimes it's like if we give a patient a little bit of narcotic before the procedure, we want to make sure that the patient's safe in the room, even if they feel like they're strong, everything like that. We just want to make sure about those things. There's all those type of little touch points that all of our team really does throughout the whole time. And the rest of the patients aren't aware of all those little things that we're constantly doing, double checking on patients. Sometimes after the procedure, they may be a little bit dizzy, so we're just going to make sure that like you're safe to go, and those type of things. It's like that kind of stuff is like, I don't know if that's really ever talked about before. I'm not sure if people really go into the detail to make sure this stuff is as safe as we could do, and that's what I try to do. I try to have it so that this is like, I want this, I could look back on my career and say that, I didn't cause anything like that. I never made some blunder like this where it caused like this adverse reaction on somebody for their body or for their life. So it's like, something that I like pride myself on, because when there's some people that sometimes pop on over here that knew me in the hospital settings and things like that. Sometimes I see like their familiar names and they used to know me at that time. And everybody knows, like, I was exceptionally careful with that stuff. I was very, very careful, and I was like exceptionally meticulous when I did my work there. And I was like, I wanted to make sure that like from start to finish, patients would be able to first of all, I should say from start to finish, I wanted like me to be like that physician that I would want like a family member to have. That's what I was trying to get to do. I always wanted that. Like I wanted, whereas like if I'm looking at a family in the eye and I could look at them and I could properly say, Les, I really did do everything I possibly could for this particular patient, and I worked at this, and I want to just be honest and like say that this is how we did it and this is what I could do. And if I'm saying we couldn't save the person, it's like really like true that like I did literally everything I possibly could in the reasonable way to do it. That was the best possible medicine to achieve the best possible result for that person. And that was like my philosophy there, and that's my philosophy at this world. Like that's the reality. It's like I just want to have it so that every single thing is like very, very clearly I could look back at my career and feel really comfortable that I did this every single time. I executed it very, very well, and I did it very, very safely. And I don't know how some people just like pop a Valium in someone and do a pheno peel on them, and it's absolutely wild. It's being done in this country too. It's like it's super cavalier, and it's done by people that don't necessarily understand the medical consequences of these things. So we got to kind of look at this and see like what are people doing. And so many people sort of like recommend them too sometimes, and they think that because it's cheaper, because like this such and such doctor is cheaper and this and that, and just like sort of price shop and stuff. But like those are like the little touch points that we try to make sure it's super safe for patients as we're doing these treatments. It's like very, very important to us to make sure that when we're doing these things that there's not going to be that kind of adverse event. It's just really like super critical that nobody really goes through what I went through with my sister, and like no other family member really has to go through something like that because of anything we're doing. And not just that, of course, like also just like in terms of when I'm doing lasers, when I'm doing peels, things like that. I definitely, I want to be able to be super comfortable on here and everything, and I want to be able to make sure that I never cause those kind of adverse events for people. Like it's super, yes, I understand there's a risk for all these things, but I need to make sure that I could like feel like I did everything possible to mitigate those risks. And like, if you could do that, that's great, and like a very, very low chance, I think, of having any real risk then. If you could really be really meticulous and really careful, and it's not just when you're doing the procedure, but before you do the procedure, you're really making sure that you're understanding the patient's heart rate, you're making sure you understand what their vitals are, you understand their blood work, all those things. And if you don't do that, I think that's you probably shouldn't be doing those sort of procedures. Like if you can't interpret those type of things, then you probably shouldn't do it. You shouldn't do it, actually. You really legitimately should not do it. You really should like kind of stay in your lane, focus on more like rashes or moles or anything else, and don't really go into this type of thing, because like some of this stuff isn't it's not for everybody. And maybe like you're not like you just know what like your sort of your limitations are, and maybe you didn't have like that strong of a grasp on different medications and different things. And then even goes honestly for I'm going to hit back with some of those questions, by the way. I'm not ignoring you, I'm just kind of finishing up like the thought process there. But that even goes when it comes to antibiotic usage, because there's so many practitioners, and that's physicians and PAs and nurses, who just do inappropriate antibiotics. It's really, really like, it's always been a pet peeve of mine. Usually it's because the antibiotic is too broad. It's like essentially you're going to cause antimicrobial resistance, which is really happening now. We really do have superbugs at this point. We're really going to be very close to like a post-antibiotic world where we're just not going to be able to use antibiotics really as much, really sparingly, because a lot of resistance now at this point because of how broad people use antibiotics. Anybody in the hospital setting knows that people go walk into the room, walk into the ER, and if they complain of a cough and someone's putting broad spectrum antibiotics like vancomycin and Zosyn on them, and it's inappropriate care, and it's like, these are community people walking around, and they'll just throw this stuff at them because they're lazy. That's what it comes down to. It's just laziness, and it's just like poor medical care. And that's the state of medicine right now today. And I had a patient that had she's a patient of mine who's a rosacea patient, and she was calling me for help because she couldn't move the left side of her face. And I knew it wasn't really related to anything with rosacea, but I talked to her. I did a video call with her just to see what was going on. And she had a very severe MRSA infection appearing. It looked like MRSA infection. It looked like cellulitis all over her left side of her face. And I said, you really have to go, likely get antibiotic right now, go to ER, go to urgent care to go take care of that. And she went to an urgent care, and she was seen actually by a physician. And the physician did inappropriate antibiotics and then placed her on steroid. Really made no sense. It was super illogical. It's a MRSA infection, and put steroid on the patient. Really, really I would say laughable, but it's actually just sad, just to do that kind of medicine. And then I followed up with her a couple of days later. She's saying it's getting worse. I look at it, and it's like, I was like, what happened? Like, what did the antibiotics? And it's totally the wrong antibiotic. So it's like, this is like where medicine's at right now. And people are looking at this, and they're proud of being physicians. And like, what are you proud of, honestly? What are you guys proud of? What are so many physicians proud of? What are so many people in healthcare proud of at this point? And they're proud of the fact that they're making some money. It's like, when you actually look at it, though, you really are like doing absolutely nothing for advancing people. And really, you probably could have made money like just like moving some money around or something like that. That probably would have been better, because at least you wouldn't have had that physician name, and people wouldn't have assumed that you had like an educated education, and assumed that you would be really careful with them. Probably should have just been like those kind of people that just shift around money, and like that's your life, like that's what you're doing, or like work at like a drone factory or something. Brandon's saying, imagine how many people are just putting a Band-Aid and not fixing the root problem. Absolutely. Yeah, that's absolutely the problem. I mean, part of it's because people are just super overworked in the outpatient setting. I know that's true. And I know that like there's a lot of different factors involved, and just exhaustion, things like that. But it's also, a lot of it is laziness. I've worked with a lot of people too. I know there's a lot of great physicians out there. I'm not saying there's not, but like there's just unfortunately there's a lot of people that got into it for like the wrong reasons. And I've said it before too, that there's some people that just, they really do. You talk to physicians, like right now there's a bunch of physicians that are like, hardcore. I saw some people on TikTok too and things like that are like pumping up like Trump and all this stuff. He's going to be better for the economy, better for that. And it's like they sort of assume that they're like in this ruling class, and they're like superior to the common people, when really physicians really should view themselves as really part of the working class, really what we really are. And it's like kind of wild actually, when like it's sort of like just viewed as like this elitist type of thing. And there's really no concern for like what policies would affect like their patients, and it's just as long as they get their tax break or whatever else is happening over there. And it's like, I'm not saying like, first of all, I don't believe in the two-party system. I'm not Democrat or Republican. I'm actually just like a humanist. But all I'm saying is that like if you're like sitting there and you're justifying this stuff, and you're like, oh well, I like it because he's better for my taxes, and you're not even like paying attention to the fact that this could be disastrous for like the poor people and your own patients. It's like, I don't know what to say about you. Like I really don't know how we're ever going to connect. And then it's like, how do I go to conferences with these kind of people? Really, it's like, honestly, how do I do conferences? How do I do anything with them when it's like, this is the way they talk, and this is like, you sit there and you're listening to this, and it's like, how do you not just like get upset when you're listening to this kind of stuff? You're like looking at this like ridiculousness that they talk about and they spout about. And personally, I feel like it's just like, it's frustrating, and it's like I've gone completely backwards. There was a point where I think there was a chance when we could have had, universal healthcare. I think there was a chance when we could have done a lot more with things, and it's sort of just gone now. And like now it's like the pendulum swung so far to the right that like, it's like unrecognizable in my own field of medicine. Let's see, I missed a few questions here. Let's see here. Can the cure laser procedure be done by you? It doesn't need to be done by me. Honestly, my team does so much of it. It does not need to be done. The things that need to be done by me, I do. Like I do the scar treatment start to finish. I will take care of you completely with that. I will, watch over all the different treatments like that. It really does not need to be done by me. There's a set protocol with it. They are very, very experienced. They do so much every single day. They do a lot with it. So it really doesn't. That's something that does not need to be done with me. You could request it for me, but my schedule is like so booked. For a cure, it's going to take you a long time to book it with me. I'll tell you that, to be honest with you. Mostly, it's more of my schedule is more open for like scars or like just things of. Scars, and also just a lot of facial balancing these days. A lot of facial balancing. Everybody's coming in right now for the holiday time. Everyone's doing that, really. So it's like, which I love doing, actually, honestly. I love doing facial balancing. I love it, actually. I like filler like in small spots, but I actually really love filler, like just if I could do it from like the forehead all the way down to like the chin. It's really awesome for me because you can just see like that wow effect. It's really, really cool. Cannoli saying, I really admire when providers are very meticulous and thoughtful. I agree that when it's something cosmetic or in med spa setting, there's a lack of understanding of the possible adverse events. And I think that a lot of it's pushed, unfortunately, by these reps. A lot of times they just kind of downplay some of the risks that are involved with lasers, for example. They downplay a lot of the different concerns that people may have with skin type, things like that. And they'll push certain products on people and say that you should buy this device, even though it's not going to be appropriate for the patient's skin types that you normally have. G's asking, what about a hug after a cure? I appreciate it. If you're doing a cure, when are you doing a cure, by the way, G? LA saying, thoughts on Easy Gel, PRF, not ready for filler or Sculptra. I talked a lot about this. I think that PRF is really kind of trending right now, which is great because PRP is great. But I don't see any difference between PRF and PRP. So just that's the bottom line the way I am. And either one is going to help you out. So I love either option there. But they're different options though. They're like Sculptra is going to give you volume. It's going to give you more collagen. And PRP is just going to help get you more blood flow. It could help improve some of the skin. User Chawada saying, is a cure laser really equivalent to Accutane? Really good question. Really good question. I would say so. I mean, I want to actually get all the data points now at this point. I know that I was usually doing based on the company's data, but now I really do have enough data to really kind of go through things and say what we could see with patients, and at some point, what the progress is. So I'll kind of pull some of the numbers over together, but really it's actually been very, very good. Really, really excellent. Actually, the things that were a problem for some patients were some of the bacteria was still on the surface of the skin when oil was going down. Once bacteria got under control, really, I think that we were able to solve this actually very, very well. And I think that's a very similar process to even Accutane, where you still may have some lingering bacteria on the surface of the skin, and you could tackle that bacteria, and then you don't really run into a problem then. What does PRF help with? So you could do PRP, PRF for the scalp or the under eyes. It helps bring in some blood flow. You could also do it just to help heal like the skin. I did that for a patient today and helped him out. It's going to help him out a ton there. How do we track the 10% back? Well, my team will do that. We will help you with that. Just everything that you do, you get 10% back in savings. So you could always ask. You could call an office, and you could always ask. You could ask for Dyra. She will help you out with it and work it through with you. But all my team could be able to set that forward for you. Carlos saying, hi, Qazi. I'm back out of the PRP. I'm major bald. I think I'm going for the transplant. Carlos is saying, backed out of the PRP. Oh, okay. So Carlos is going to do a hair transplant. I can't ever fault someone for doing a hair transplant, but do it also with something like oral minoxidil, oral finasteride. do it with topical minoxidil, and PRP would still help afterwards. You'd still want to get some blood flow. You still want to protect it. So take a look at that. It actually, I do a lot on patients after they do hair transplants, but I have no problem with people doing hair transplants. If you need to do a hair transplant, you have to do a hair transplant. I have no problem. Where are you getting the hair transplant? But I'm not in the hair transplant world. Like, honestly, to me, I was looking at it. I was actually going back and forth for a while. Should I do hair transplant? I had a lot of friends that, like family members, that really wanted to do hair transplant. But I was looking at it, I was like, it's very, very expensive in this country to have like the team and the setup to do it properly and like to just do it really, really effectively. And it felt to me like there wasn't as much, maybe I'm wrong, but it felt like there wasn't as much art to it. And I was like, they could do a very good job overseas and like and everywhere. So I was like, I don't know if this is really something that we should that I would want to pursue like that, because it's like they could do a good job elsewhere. So it's like it wasn't something that I could just felt like I was just going to be excellent at it. It wasn't like, it was just seemed like you just follow the protocol with the machine. I never really liked doing that. I don't really love like just like following like the way the protocol is for the machine, because it's just like really cookie cutter. And these machines, like the protocol that it is, it's a lot of times not the best. And so I was like, I don't know if I would really want to go into that to a hair transplant. So yeah, absolutely. Wherever you're getting it done, just do it safely and be careful with that. Can you do laser on sensitive skin? And how do you do it safely? Yeah, I do. Most of my patients actually have sensitive skin. We always prep your skin before we do lasers. We always do that. So we're going to use a certain skin prep to do that. We're going to use moisturizer, sunblock. You're going to stop all other creams. You're going to be fine with me. And then I'll help you out afterwards with just recovery with a lot of moisturizer and just really rapidly recovering there. Let's see here. How is this occurring on melanated skin? I talked about acne scars. Or you talk about that. I prep your skin before we do scar treatments for melanated skin. About 80-85% of our patients are Fitzpatrick 4, so we do it a lot. User Chawad is saying, so how do you tackle the bacteria before a cure to help with the purging and return of acne? My go-to usually is going to be Dapsone. If there's a sulfur allergy, I may do clindamycin, but go-to is usually going to be Dapsone for that. And maybe if we are worried, if there's like a lot of purging, we could do like an oral antibiotic as well. How about diabetics? Can you do scar treatments? Yeah, you absolutely could do it, but you do still want your A1C normal. So really it should be less than 7 ideally, but really, that's still not going to be great. Ideally, I want it like 6.5. So as long as your sugars are under control, we could do it. Let's see here. Can I do TCA and laser for dark skin? Yeah, I just did it today. I do it multiple times every single day. How dark are you? What's your skin type? Do you burn at all? Do you only tan? Let's see. How about, let's see, I know a question there's. So PRP helps with damaged skin. Yeah, PRP could help with the healing process afterwards. Always Blessed saying, do you always make your patients use Aquaphor? Not so much, actually. Aquaphor has a little bit of alcohol in there, and so I don't actually use it as much as a lot of other practices. I talked about it yesterday, but that's actually another thing about laser safety. The patient actually had a big gaping wound on the right side of his cheek, and his practitioner had just said just to do Aquaphor, and then it looked, I did a consultation with him, and it looked like it was an infection possibly. And so it's like, you don't just do Aquaphor like immediately after when it's like open wounds like that. So you don't do it that way. You want to make sure that the skin is intact, so you could put some moisturizer on it, and then you could put the Aquaphor on top of that. Let's see here. Kaylin is saying, I only tan. Is there a wait time between TCA and laser? Usually I do it the same day. I just do both of them the same day, especially the first session. If we need to do laser, but maybe we don't have to do laser. Some people, like I did one of the patients today, she's darker skin type. I only did TCA cross for her. Let's see here. How much is the treatment? Most patients for scars are $5,000 to $7,000 for scars. Always Blessed is saying, I did Morpheus 8 and she put Aquaphor and made me break out so bad. Well, I'm not sure if it was the Aquaphor. It could have been. If you put it on immediately afterwards, that'll be a concern because you have open wounds in your skin. That's what I'm talking about. Did she put it on immediately after? Did they put Aquaphor immediately after doing Morpheus 8? Hopefully you could clarify that for me, because that's a little bit shocking to me if they did that. What you're saying, how does TCA cross differ for ice pick and boxcar scars? Good question. So with ice pick scars, we usually could use a little bit stronger concentration if it's a little bit deeper. So it depends on the depth of the scars, but I sometimes can go a little bit stronger concentration over there. And then with boxcar scars, especially the ones that are more superficial, a lighter bit of the TCA. And a lot of times I go in the inside wall to get a little bit of scar contraction there as well. That's usually what I end up doing with boxcar scars. But you could do it for the boxcar scars. You could do it for rolling scars even. People don't realize that you could actually do it for rolling scars too. It's not true that you only do it for just ice pick scars. I do it all the time. In fact, I have a whole long video on YouTube. I really recommend watching it for everybody that wants to understand this process. You can really watch pretty close to start to finish work that I did on a patient. A really excellent, beautiful progress that he has already too. And he's somebody who's, he said he eats really clean, really good diet, exercise, all those type of things. And you can see his amazing results really relatively fast actually for him. So take a look at that. It's on our YouTube. It's one of our last videos or so. It's like 17 minutes long or so. Hi, saying thoughts on doxycycline. Well, it's good for, if you have cystic acne, you want to do like a quick burst of something to really calm down the inflammation and solve that bacteria over there, then doxycycline could be good. I usually don't have people on it for like kind of just indefinitely the way that a lot of people do. I do it more for like short bursts, and then potentially we usually just would use more like topical antibiotics or topical antimicrobes. What's the best laser for deep skin? I'm not sure what you're referring to. Are you talking about deep scars? Or are you saying the deep scars may not even be a laser then? You may just do like subcision or excisions. You may do something like that. You don't necessarily do laser for deep scars there. Victor is saying my rolling scars completely disappear when I pull my skin back. Would subcision be needed? Not necessarily. Then, if it's completely disappearing when you're pulling back, you may not need it. Maybe just laser would solve that. I'm not sure exactly. Maha Sayed is saying, does Cyton laser good for tattoo removal, specifically if the tattoo has white ink? Which Cyton laser are you referring to? Are you saying that you just use like a profractional erbium laser for that? Is that what you're asking for that? I'm a little bit confused about that. Let's see here. How much time off will I need to treat scars? Usually 1 week. Most of it's for the first 4 days, and then it's like a few days after that, still redness. Do I do Renuva filler for face and body parts? I looked into it before. It seemed really pricey. I get great results with Bellafill. I'm open to it though. I'll take a look and see kind of like maybe the price is different too. Now, it was just very pricey for like little tiny bits of it, and you just need so much more for it. So I just didn't ever really, pursued it for that. Mario is saying, do you put filler under ice pick and boxcar scars? Yes, sometimes, especially if it's like a cluster of ice pick scars and there's a lot of volume loss, you probably need to do some filler for that. Let's see, Carlos is saying, will PRP help with damaged skin barrier? Yeah, PRP could help with that. Carlos, do you feel like your skin barrier is damaged? Hasn't it just been a few weeks for you? Stephen Hallam is saying, I TC across 80% 2 years ago, and the spots where the acid were applied are still red. How to fix it? We likely are going to need to do something like XLV laser, where we're basically going to target those little red vessels and just basically help your body reabsorb that. Let's see here. Yes, it's on our YouTube channel. So if you go to our YouTube channel, you'll see we have a bunch of videos. We have some things that basically we had several videos of kind of like start to finish. But the last one that we did, really, we tried to show. I did like a whole like overview of like everything I'm doing as well. So just take a look at that. I think it'll be something worthwhile for anybody curious about that. Mama is saying that they did Aquaphor immediately after Morpheus 8. Wash that stuff off. Honestly, that's really unfortunate that they did that. You're breaking out. You probably could do like an oral antibiotic, and that could probably help you out there. And also, it could also be a bit of a histamine reaction, so take a little bit of Claritin too for the next few days. Carlos is saying it's been good, but sometimes I peel. I think it's dermatitis. Well, it's only been a few weeks. It's likely going to be some irritation right there. But let's take a look and see. At some point, I doubt that it's really more than that. Really, after a few weeks, it's very normal for the skin to be really sensitive. Really, for about like 6 to 8 weeks. A lot of times, it could take even a little bit longer. Sometimes it just depends. Everybody's treatment's a little bit different there. Maha is saying, and speaking of subcision, I have done subcision many times, but I feel like I haven't seen a result. What other techniques if that doesn't work? Well, you never did subcision with me. I'll tell you that. Okay, there's only a few people that I would trust with subcision, and I'll just tell that honestly. Really, like if you tell me the name of someone who did it too, maybe I'll say if I would trust them or not. But chances are, like people just haven't been doing subcision properly, and maybe your scars weren't even appropriate for subcision. I don't know, but the truth of the matter is that there's so many people that do subcision. The result that we posted today, Take a look at our Instagram page. Actually, I'll show you guys that. I did it earlier during the week, and before I leave, I'll show you that. But you can see this patient, he did 4 subcisions with somebody who does a ton of subcisions. And I've done multiple times now revisions on patients who've done subcision with him, and there's so much scar tissue in there. And it's like clear that it's just, it's not done the full way. So I want to show you this. This was also on our page. You can see it's huge right now, but let me try to make this a little bit smaller for you. This is the one that we posted today. Super happy patient. He messaged us the other day just about how happy he was. And originally he wasn't letting us share his results, so we didn't really have the treatment process. But he loved his results so much. He's like, yes, you can share it, which I appreciate it. So let me just try to make this a little bit smaller for you. So this is a patient. He did 4 subcisions before. He also went and did some peels as well. And, it's significantly improved. Look at that scarring, significantly improved. And it's, and when I went in there for subcision, there was so much scar tissue. And it's like, I don't know how people say that they, I don't know how they feel comfortable and confident in saying that they do this all the time and they're experts at this stuff when they're doing subcision that's, not the best. So do this really, really well, or don't do it at all. Like whatever you do in life, do it really well, and try to attain excellent results, whatever you're doing. It doesn't matter what you're trying to do in life. Just feel like really comfortable and confident in the job you're doing, and that like you could be really proud of it and like just be really happy with it. Otherwise, just don't do it. Like find something else. I don't know. Like I know everybody has to make money. I get that, but like, there's probably other ways of making money that don't involve just wasting someone else's money. If that makes sense. You can make money without like taking someone else's money. This is possible. There's ways of doing that. It's actually like a really, really cool thing to do. Just make your money, but like don't steal people's money, and don't try to like say that you could do this and you can't. So it's like you clearly you couldn't, because it's like do it 4 times and I could do it a single time and it's like super smooth afterwards. So clearly, some people shouldn't be doing as much subcision, and it's a risky procedure. I don't know why you would try to do an invasive procedure on somebody 4 times like that. It's really, really unfortunate that people put people through that like that. So you can see this is a patient like that we did. So subcision, very, very different. It's not something that like, I would say anybody could just do. Monica Ludu is saying, I had subcision 3 weeks ago along with CO2, erbium, TCA, and Bella Hill. Dr. Q is the best. I appreciate you so much, Monica. I really, really appreciate you. Thank you. Thank you so much for coming on for saying that. Let's see here. I know I missed a few questions over here, but if you have any questions about this, I'll be happy to answer. And this is also like so many people say, well, I did TCA cross, I did TCA cross and it didn't do anything. Well, it's like, or like it made it worse and things like that. And I'm sorry that there's people out there that couldn't do it properly. I really am. That's partly what I'm trying to get to. I had a patient today that did so much of TCA, not TCA cross, I should say, did so much microneedling. She has so much microneedling and she had no results from it. And her scars were ice pick scars. So it's like, why is somebody doing that? Why are you doing ice pick scars in there? There's like ways of achieving what you want to achieve without doing stuff like that. And it's really cool to be able to do that. It's a really cool experience when you're not doing it to someone. It's like you could obtain the things. Everybody's obsessed with trying to get power and trying to like just get money and things like that. But like, what about just doing things just doing things really ethically and doing things really clearly, and allowing people to achieve the best possible version of themselves without without bringing them down because you charge them so much for something that was ineffective. Now they're potentially in debt over the fact that you couldn't do things effectively. Some of these people are like $20,000, $30,000 they spent on stuff, and it's like this particular patient, I think it was like $20-something thousand he had to spend before he discovered me, and it's like it's unfortunate. It's really unfortunate there. Now, like I could look at him and he's super happy and like we're there and like he got it, and it's like, we've achieved what he wanted to achieve for his skin, and now he's trying to sculpt out his body, like his face more, things like that. And that's really, really fun. It's really fun to be able to achieve that. You know, it's like, why can we not just have people just do that? Why is it that we have to feel like this has to be something that's like a zero sum thing, that like you win and that the other person just, who cares if they win or they lose? It's just, that's the game. And if you don't do it, if you don't scam someone else is going to scam someone. And it's like sort of like everybody sort of thinks that like, if I don't do it, well, someone else is going to do it, someone else is going to do that, and like there goes that business, blah blah blah. And it's really unfortunate, because it's like, yeah, probably, you know, there's going to be some people that you're going to lose from that kind of stuff. That, you know, you if you sort of promise that you're going to get like a certain expectation for somebody, and you just like you tell people that, and you lie through your teeth that you're going to do this, and it's like you could get some cash from that, but at the end of the day, it's like it doesn't really feel great though. You know, it's like you're looking back and like, I guess you have some money. But like, hey, you know, it's like, is it really like when you're walking down the street and you really feel comfortable and happy with what you're doing for society, and you're really like looking at things and like you're really thinking that you're making a positive impact on the world actually, and maybe you just don't care. You know, I know a lot of people just don't care, but I actually do think, I really, really do believe that there are a lot of people who actually do care and actually do want that, and actually, you know, they just, whatever circumstances they have, like with money and things like that, I get, but they actually really do, genuinely do want things to change and want people to actually be able to go to achieve a higher level. And like, that's also like what their dream is in the world. And it's like, there's actually a lot of people like that. And wouldn't it be nice if like all people like that just continue to kind of band together and like realize that like there's a way to achieve things without like, scamming stuff. And there's a way to do something where it's like, we could do it safely and effectively, and we could do it, consistently. And we don't have to like really be pricks about it. Isn't that going to be a cool thing to do? Like, isn't that going to be amazing if we could get there at some point one day? And like, everyone thinks that, well, somebody's going to take advantage of us, so we have to do it. And I have to be the one that's going to trick that person, because otherwise you're going to get tricked by someone else. If I don't do it, someone else is going to do it. But like, maybe you could be that person that like stops that cycle. Like, maybe you could be the person that stops the generational problem that we have in society at this point. We're just getting worse and worse and worse like that. You could be that person that like helps us be able to achieve that. And really, it's like, if you actually look at it, and I want you to actually think about it, like when you're looking at the things that you do and kind of the decisions you sort of make, and kind of look at it and see, like, sometimes would you make those decisions if nobody was watching you? And it's like, that's sort of like how you can start changing and shifting yourself and like making sure that you can become a better person. Because it's like, why is it that you have to do something that's like positive just because someone's watching you? Maybe it's like a really nice thing and great thing that like you could just do this and do it in a way that like, it's beneficial for someone else. And it's like, this is like how you could spread like positivity in this world. And it's like, it no longer has to be this constant cycle of like just nickel and diming people and scamming people. And we no longer have to have that in society. Like, maybe there's a lot more of us. Maybe there are. I think there are. Actually, I do. A lot of my patients are that way. I would tell you that a lot of people, like, I offered pro bono work. I do pro bono work. And Nikki's saying, does he answer people's questions? Yes, I answer a lot of questions. But I do a lot of pro bono work, and I had told people that like, just only do it, only submit yourself if you really are like in dire straits, you really need that type of thing. And it like turned out not everybody, but almost everybody submitted it like that. And they like wanted to kind of just let the people that really deserved the pro bono stuff do the things, because they knew it was limited slots, and they did that. And it's like interesting, right? Like, it's an interesting type of thing. There's a lot of people that really are like able to like feel that like, even if this was something that could have benefited them, it could benefit someone more deserving, and they're going to allow that person that's more deserving to do that. And hey, that's something very, very different than what they try to teach us. Everybody tries to tell us that like Adam Smith, all these guys, Ayn Rand, everybody tries to act like everybody's just selfish. But maybe like there's something more to it. Maybe like they're selfish. Maybe not all of us are. Maybe they're the ones that are selfish. Maybe they're the ones that have been a problem this whole time, and their economic policies and their beliefs are holding us back, and we should just like let go of all that and just start making our own rules without them, and just sort of carve out our own world without these kind of things. And we could do that within whatever industry we're in. And so I'm in this little industry, and that's the industry that I'm trying to focus on, and to do it that way. So whatever industry you're in, do it that way, and it'll be like, it's pretty cool. Like, one day you look back and you're like, you could do that, and it's there. And it's like, there's a lot of people that like that. Let's see here. Hi, please help. I have PCOS and unused Vanica and didn't help chin hair, and I did laser 4 to 5 rounds. It came back worse. What can I do? Well, you probably should be on like something like oral spironolactone. That's probably a good idea if you have PCOS, and that'll help keep it at bay in the future. And then ideally, you could consider if it's something like little stray hairs, you could do something like electrolysis. Nikki's asking what treatment was done in this photo. So we did a few different things. We did talar liberator subcision for him. We did TCA cross for him. We did ablative CO2 laser for him. We did fat transfer for him. And we did that over 2 sessions. And then we also, then we did another session where we did a little bit of Bellafill. Let's see here. What treatment are these results from? So I think I got that down. So there's a few different combination sessions for acne scars. By the way, this is never a recording. I'm never going to like trick you guys and put a recording up there. If I can't make it for the night or something like that, I'm just not going to come on. I know so many people say, is it a recording? Is it a recording? This is not a recording. I'm here. So just so you know, appreciate you, Monica. Monica is on another platform over here and saying really, really nice things. Appreciate you so much. I'm so glad you're already doing well, Monica. If you love your results right now, in like 6 months, a year later, you're going to love it even more. Honestly, you're going to really like it. It's going to be really cool. And you're going to look back and like sort of one day and like, and kind of like forget that you did some things, and like people are just going to compliment your skin, and then you kind of remember that there's like a curly hair doctor that like you went to, and like it was like good, and it was like you went through a lot, and like to get that skin, and it's going to feel good. It'll be really good. Rise saying, I wish you were in Australia. Well, you know, Dr. Davin Lim is in Australia, so feel free to reach out to him and see how he is for you. Let's see here. I've heard talar liberator subcision is unsafe. It could be. Yeah, it could be unsafe. There's a way to do it. There's a way to really make sure you can do it really safely. But it could be unsafe. I think some people do it unsafely. There's not many of us that do it really in the world. I don't know, maybe like 10, maybe less than 10, maybe. It's like, you know, I kind of lost track of it. I think it's probably less than 10 of us in like the world that do talar liberator. It's really like you have to be very, very careful with what you're doing with that. And I am. Anybody that's done subcision with me knows that like I'm very, very careful with this. I'm very, very careful with how I do all my procedures. This is actually 6 months out. Someone's asking, is this, this was 6 months out right here. Close to 6 months. Thoughts on using hydroquinone? I don't really love hydroquinone, honestly. I don't usually use hydroquinone, especially for pre-treatment. Don't really use it for that. Hopefully, you know, that explains it. Although you could do it, of course, if you have significant pigmentation. I'm not like against it for short bursts and stuff, but I just myself don't really use it too much. Explain that subcision technique. So watch my YouTube video. Watch it because it's like it goes through like everything. I'll go through tomorrow a little bit more for subcision if you have questions. But watch my YouTube video. I have a whole long thing of how I do subcision, so you can see it and see like from start to finish really that process, and you can see how I do subcision. And just watch like how careful I am with the stuff. Like I am very, very careful with what I do for it, and I'm pride myself on that. Like it really makes me happy, just like being really careful. It's like you know, so like I like doing things like really well, but I also really like doing things really carefully. It's like really feels good to me that like I have that and I can do it. It's sometimes slower than like I agree. Sometimes it's like I wish I could rush things. But at the same time, like I had a video up there showcasing that one time, but like between like results versus safety, I'm always going to choose safety, really always. That's like the bottom line. I'm always going to do that. Guys, I appreciate you. I went way overboard tonight though, so I will be back on tomorrow for the last day of the week. I'll see you again tomorrow. But I saw a bunch of your questions, so I'll try to get those tomorrow. I do steroid shots after nose job. I do that. I've done a lot of that actually. It works really, really well for the right patient.